we'll be in a small group discussion on normality and mental health. To start with, what is mental health? Mental health is just not the antonym of mental illness, or it is not just the absence of any psychopathologies. This will be displayed in the several models which were proposed for as a concept of mental health. The models of mental health, there are 6 models, which says first is mental health as above normal, mental health as maturity, mental health as spiritual emotions, mental health and socio-economic intelligence, mental health as subjective well-being, and mental health as resilience. If we have all of this, then we say it is mental, the person is normal or it is mentally healthy. First is mental health above normal. The Sigmund Freud says, gives the definition of mental health as capacity to work and love. Mental health refers to a reasonable rather than optimal state of functioning. Health refers to a reasonable rather than an optimal state of functioning. Then comes to mental health as maturity. Optimal brain development requires almost a lifetime. For example, if we say a 10 years old lung and kidney reflects optimal functioning than those of a 60 years. But this is not true for a 10-year-old CNS. Adult mental health reflects a continuous process of folding and unfoldings. Physically healthy 70-year-old is mentally healthier than they were at their 30s. Immature brain functions less than the mature brain. Thus, adolescents are mentally healthier than toddlers, and middle age are mentally healthier than the adolescents. The causes being the progressive brain myelination and evolution of emotional and social intelligence through experiences that the adults have. Now, there are various tasks to achieve this mental health as maturity. The first one being the identity. Task of identity requires the mastering of last task of the childhood. That is, we need to have our own identity, which is separate from our family's identity. Sustained separation from social, residential, economic, and ideologic dependence on the family is separated, and then our own identity is formed. Thus, we say, where once family values ends, our own values begins. The second task which we have is the intimacy. This helps them to become reciprocally and selfishly involved with the partner. Relationships can be with any person of same gender. Sometimes it can be entirely asexual and sometimes even religious. The third task that we face is career consolidation. In career consolidation, we need to have contentment, compensations, competence, and commitments. When we fulfill all these, we say that we have career consolidations. Then we have generativity, clear capacity to care for and guide the next generation is generativity. For example, between the ages of 35 to 55, our needs for achievements gradually declines and our need for community and affiliations increases. Generity means serving as a consultant, as a guide, or as a mentor. Good mentor learns to hold loosely and to share responsibilities. Then lastly, we have integrity. In old age, it is common to feel that some life exists after death and that one part of something greater is in ourselves. Integrity is achieving some sense of peace and unity. Mastery of one life task is not necessarily healthier then mastering the others. Sequential tasks are offered as roadmaps to make a sense of where they are. Thus, one can be an immature 50-year-old adult, which is unhealthy, and there can be a mature 20-year-old boy that is being healthy. The third model is mental health as spiritual emotions. This model defines mental and spiritual health as the amalgam of positive emotions that bind us to then bind other human beings to us. Love, hope, joy, forgiveness, faith, compassion comprises the essential positive and moral emotions. These positive emotions are generated in limbic system. They're involved in human connections. And none of the emotions listed is just about being self. However, negative emotions originate in the hypothalamus. They precisely comprises of fear and anger, and it is all about me. Positive emotions are more expansive. They help to broaden and build. On the other hand, negative emotions are crucial for the survival in present times. Positive emotions, they affect the CNS in common with the relaxation response of the meditation. They increases the parasympathetic response, reduces our metabolisms, blood pressures, heart rate, respiratory rate, and muscle tension. Whereas the negative emotions, they causes metabolic and cardiac arousal in response to fight and flight. Thus, they induces the sympathetic system of our body. Positive emotions have biological basis. They have evolved through natural selections, and only the mammals and Homo sapiens have these positive emotions. This is also followed by the response in limbic system. Limbic system is responsible for our positive emotions. In particularly limbic system, orbitofrontal region, anterior cingulate gyrus, and insula, they provide motivational salience for lovers, which also helps in the reward pathway for the drug addicts. It is crucial in detecting whom we should approach and whom we should avoid. Prefrontal cortex is in charge of estimating rewards and punishments. It helps in adapting and regulating our emotional responses to new situations. The fourth model is mental health and socio-emotional intelligence. Aristotle defined socio-emotional intelligence as anyone can become angry. That is easy. However, to be angry with the right person to the right degree at the right time for the right purpose and in the right way, that is not easy. The capacity to identify different emotions in ourselves and others play a vital role in mental health. Benefits of reading, feeling from others' non-verbal cues have been demonstrated to be of much scope. These benefits include being emotionally better adjusted, more popular, and more responsive. Empathetic children do better in school and are more popular than peers without being more intelligent. There's a program which was started in US, a Head Start program, which found that early school success was achieved not by intelligence, but by knowing what kind of behavior is expected, knowing how to run in impulse to misbehave, being able to wait, knowing how to get along with other children. At the same time, the children must communicate his or her needs and ask teachers for help. The more skillful individuals are in identifying their emotions, the more skilled the individuals will be in communicating with others. That is, the more you are skilled in empathy, more others will value you, and greater will be your social support, self-esteem, and intimate relationships. Following criteria can define social and emotional intelligence. The first is accurate conscious perception and monitoring of one's emotions. Modifications of emotions so that our expression is appropriate. Accurate recognition of and response to emotions in others. Skill in negotiating close relationship with others, and capacity of focusing emotions towards the desired goal. These days, videos of sustained family interactions reveals that an essential part of healthy infant development of adolescent development and marital harmony is how partners and parents respond to the emotions of each other and their child. To ignore, to punish, and to be intimidated of contemporary of how others feel spells a disaster. Children of emotionally attenuated parents are better at handling their own emotions and are more effective at soothing themselves when upset. Such children even manifest lower levels of stress hormones and other physiologic indications of emotional arousals. Nowadays, there are increased efforts even in school to teach school children a core emotional and social competence. The new term emotional literacy has now been on run in various schools. The fifth model being mental health as subjective well-being. Positive mental health does not involve being a joy to others. One must also experience subjective well-being. Subjective well-being is not just the absence of miseries, but the presence of positive contentment. Subjective well-being, like optimism, becomes an antidote to learned helplessness. Distinction is made between the pleasure and gratification. Pleasure is in the moment, closely allied with happiness, and involves satisfaction of impulse and biologic needs. It involves satisfaction of senses and emotions, while the gratification involves joy and purpose, that is, satisfaction of being the best you can be. The sixth model is mental health as resilience. Coping mechanisms that humans use to overcome stressful situations are of three types. The first is consciously seeking social support. That is, how individuals elicit help from appropriate others. The second is conscious cognitive strategies. In these, individuals intentionally uses conscious cognitive strategies to master their stress. And the third is adaptive involuntary coping mechanisms, which are called defense mechanisms. These distort perceptions of internal and external reality to reduce subjective distress, anxiety, and depression. Involuntary coping mechanisms reduce defense mechanisms. They reduce conflict and cognitive dissonance during sudden changes in internal and external reality. If such changes in reality are not distorted and denied, they result in disabling anxiety or depression or both. Such involuntary mental mechanisms can restore psychological homeostasis by ignoring sudden increase in impulse, affect, and emotions. Such involuntary mental mechanisms provide mental time out to adjust to sudden changes in reality and self-image. Involuntary mental mechanisms can mitigate sudden unresolved conflicts. And thus, because of this, the mature defense mechanisms were introduced. The first mature defense mechanism is humor. With humor, one sees all, one feels much, but one does not act. Humor permits discharge of emotions without individual discomfort and without unpleasant effect upon others. Altruism is getting pleasure from giving to others what that person themselves would have liked to receive in that situation. The examples are alcohol anonymous groups, which share their feelings to help others who are currently the patients of alcohol dependence. The third is sublimation. It is a defense mechanism in which we act out unacceptable impulses by converting these behaviors into some more other things. We say distracting ourselves. In suppressions, we modulate emotional conflicts or internal and external stressors through stoicism. Suppression minimizes and postpones, but does not ignore gratification. And the last is suppression is like if we are scolded by somebody, we don't give the impulse immediately and we leave it to react for later. Like turant gussa na karke, we leave it to react later. And lastly, anticipation, that is the capacity to perceive future dangers effectively as well as cognitively. The future directions for this mental health and normality and mental health is psychiatry understands how best to facilitate the transmutation of less adaptive defenses into more adaptive ones. The suggestions includes to increase social support and interpersonal safeties, to facilitate the intactness of the central nervous system, that is rest, nutrition, and sobriety is important. With this, I bring it in. Thank you.
I would like to open the house for the discussion, comments, any contributions. Very interesting topic. Very deep psychiatry for it. Whenever we deal with the India, we can generate your questions. May not be strictly model based or something. Really this issue. What is actually normal? What we are saying normal?
Sir, to
what we are
achieve,
saying abnormal.
Sir, when the mental
The
health
intensity, so we should know that this is what we find normal. This is
firstly, mental health is not only a one domain where we say we don't have a mental illness. If we are mentally healthy, that is we are mature, then we have a spiritual emotions, we have socio-emotional intelligence, we have resilience, and we have it says mental health above normal. If we have achieved all these domains, then we say we are mental.
It's very difficult to be normal. It's so difficult.
It is like mental health is reasonable rather than the optimal state of functioning. मतलब perfect होना जरूरी नहीं है. We need to be like standing out in all the domains of the life. We need to pass through peacefully in all the phases of the life. We may not be perfect, but if we are like doing it without harming ourselves or the society, and we are not facing our stress to a level that we cannot bear it, we are healthy.
Mental point of view, well-being. Maybe the most closest well-being then have a lot of other cases and can have a lot of bifurcations when you can go into all these. As WHO says, what is the normality definition, we want the definition of security. Mental, physical, spiritual well-being is normality.
Huh. No. Every individual, every situation, and every environment they are. Supposingly, for me, we can say sickle cell anemia is a dangerous trait. But for somebody who's living in a place where malaria is common, for them it becomes an advantage. So their sickle cell, having a sickle cell anemia is a advantage. So that is normal for them. So it depends on the individual, the place, and the environment.
What is abnormal?
Starts at the
So daily life of the sense that it is dysfunction.
Dysfunction.
So only dysfunction.
Dysfunction to self and to the society.
Society. So this is abnormal. More than that, abnormality can be more than this. A lot of people who come to our consult us, they're not dysfunctional. They have something else.
Dysfunction to self. Like they are not able to handle their daily
Psychiatric
course.
thing. Distress. Distress. Them.
tangible and intangible.
Oh.
Tangible, what are the things we have to really, we have to write daily living. Intangible, what are the things we have not to do daily life?
So how it is in context of normality and moment. How do you explain it?
Like a spiritual, like a by applying emotions, behavior, become all the things, all the cases we cannot able to do in normality.
For example, if you say homosexuality, decades before we used to say it's abnormal. Now we are saying it's not. Then how we explain? Society context changes, our definition and the reference point also changes. That is also part of the definition of normality. The society, societal culture, the viewpoints, the history, everything, the legal aspects, they also have some say in defining what is normality. Like just saw one patient who had this transgender issue, but he was saying that I will not disclose it till I am very sure that I will be accepted legally by the state. Because legal context changes with maybe every 5 years, the government changes, the perspective changes, then we get different notifications. Child, anything how confident in psychiatry we divide this. These are people are normal, these are normal. When we deal with patients. Someone who says that I'm normal. Why are you saying that I'm not normal?
Sir, that is the like it's written that psychiatry does not treat the illness, and sorry, psychiatrists don't treat the illness. We make patients learn how to come up with their.
Because Freud said that it is an idealized fiction, can never be achieved. You're right. In a way. Anti-psychiatric movement says that these people are deviant. They have something against which society doesn't accept and they want to suppress it. That is why psychiatry is a no-mean branch. It's a useless branch, almost as it says. There's something, so one of the definitions of abnormality is deviancy. There's a distress, there's a dysfunction, there's a deviancy, there's a dangerousness. Or your base of 4 TR also had given these all 4 aspects. In that sense, at least we know that this is not abnormal. These domains can be defined as abnormality, which we also see in patients. Abnormality में dangerous है, dysfunction है, distress है. और वहाँ पे प्रॉब्लम आता है कि जहाँ पर हम लोग इस तरह के ट्रांजिट इश्यूज की बात कर रहे हैं, there we have to see all the broader context, even more context, which at times are not very specifically trained in our course. Any other points?
There is a lot of social problems. It's also considered like a people impact, say, poverty, theft, murder, other activities. Those are already you said mentioned social deviance, social deviant behavior, like trafficking, moral trafficking.
So in that case, the person may be getting more psychiatric moment. Still, you have a normal behavior. It is considered normal. So again, that will be abnormal, but not. Yes. A very interesting experiment I was reading that Rosenhan, the scientist, he published it in Science, 1973, very famous journal. What he did was, he, without telling anyone, pre-hospital, he said patients, normal patients, and told them that you get admitted, and you will only tell them that you are having auditory hallucination, and you behave normally there. They got admitted, all of them received diagnosis of schizophrenia, but they didn't get schizophrenia. And they got treated, they received antipsychotics, and they made notes, and then it came out, it was said that 100% of them were diagnosed, none of them were diagnosed as normal. जो psychiatry hospital में गया, they were diagnosed as having some, in this context, severe mental illness. Then what he did, one of the other hospitals said that we will not commit this mistake. You send patients. He said, okay, next 3 patients, next 3 months, I'll send patients. And in next 3 months, when they brought their data, that they said that 20% were sugar patients, 20% were these patients, 20% were these patients. And interestingly, next 3 patients, he didn't say, next 3 months, he didn't say anything. And still they, so the patients who had schizophrenia, psychiatric diagnosis, they told that they were having they were
sugar
normal.
levels.
So very interestingly, this actually brought a lot of embarrassment to psychiatry. This paper, it was published. That is one of the pitfalls, that if you don't have any, say, organic objective to assess the brain function. Here also, if some patient comes and tells me I'm having hallucination, please give me the medication, and then you might take advantage of it in some legal situation. You can't help it.
But then we see the dysfunction and the distress
he comes alone, he comes with his brother who's also involved.
So we usually say that साथ वालों को लेकर
कितने पेशेंट हमने आज तक वक्त पे देखा है कि नहीं सर ये लग रहा है. If patient is doing this for psychological symptoms like hallucinations, either we admit them, study them exhaustively, then maybe we take out this practice, because of lack of any investigation. To take it context like medical normalcy. So even there, like having an illness is different. Medically, medical fitness is different. If somebody is a sports person, he's required to have a different level of fitness. In different areas, you have different criteria. For example, somebody is to go to the army, so you will be assessed on certain criteria, vital capacity, or practices. They will say that you are not medically fit, but basically normal. And that is why, because of this controversy, these issues, which are very difficult to tease out, the concept of categories was challenged. Because initially, when ICD came, PSM 1, 2, 3, 4, there were categories of mental illness. Okay, this category was fit kar gaya, they had person had mental illness, and inke bahar nahi. People said ki what if 4 criteria nahi fulfill ho rahe, 3 fulfill ho rahe. So whether those people will also have mental illness or not. So this was a challenge, because आपने category नहीं दे सकते आप normal abnormal. You can't actually shape it into one circumscribed entity. Then the spectrum concept came. Then DSM-5 tried to actually broaden the spectrum. ठीक है ये ऐसे वाले हैं, ये attenuated हैं. Then these anti-psychiatric movements said, people said that with this, half of the population of this earth will have some psychiatric. So these arguments and explanations, counter explanations will continue. That is why it becomes a very important subject. Like the DSM part where impairment was necessary for diagnosis. So it became a double-edged sword. Like if somebody has a disorder, that means he has impairment. And if he doesn't have an impairment, then he doesn't have a disorder. Many people challenge this. I think Tourette, they challenge that. They said that you can't say that we have impairment. Okay? Like patient group present, we are talking, okay, we have this condition, still we are normal, but we require some treatment also. So these are the things. For example, it is not necessary for somebody having diabetes to have impairment, like some functional problems or some direct consequences of the illness. But that is also one thing, like impairment, whether it is how it is necessary, we can have conditions where impairment may not be there, still considered. So it is very difficult to give one definition of a normal based on multiple criteria. For example, your impairment, presence or absence of symptoms, or anything. Sometimes people may have some pathognomonic symptoms, still they may not be diagnosed as a disorder. They may not have impairment. On the other hand, some patient may have severe impairment, does not have very severe symptoms. So, in continuation, what sir is saying is that what it is normality and normality we can only define when we follow it up. A process definition is also कि प्रोसेस है यहाँ पे क्रॉस सेक्शनल नहीं कर सकते ये नॉर्मल है आज इस पॉइंट पे नॉर्मल मे बी वी हैव टू सी इट लॉन्गिट्यूडनली and with this we'll get more clarity like Erickson's developmentally those concepts those are longitudinal those are never cross section so maybe in that context we also here are very sure about patients normality and normality when we follow them one point we can't do much and specifically in context of child psychiatry is important. Now mobile usage, how much it is abnormal, how much it is normal. We don't know. No one has any cut-off criteria and even dysfunction post-COVID things have changed now. So in that context, this is a very, very challenging situation we're facing. Most of the mothers, parents are more concerned with put it in mobile data. How to tell them? We have to have some objectivity to tell them. It becomes more subjective then. Problem challenge with normality and normality is subjective. I feel like normal है, might be some might feel like normal. There's again a challenge. As she said in one of the models. Okay, I think 9:45. We can go on for this point.
We have covered many things in this topic, like coping mechanism, positive mental health, what are the negative emotions, like primary emotions, secondary emotions, towards the patient. Particularly, this topic is very important to know about more related to the specialization in psychiatry, how to deal with the patient, each and every the context. Thank you.
Before coming to Sir's comment, I would say that you have actually done a very good job. It's a very good project. And I think we learn with time very quickly. Then I think all of us we learn quickly how to simplify things and present it in a more simplified. So that is very difficult. I think it was a very good presentation. I think for the presentation, it should be interesting and it should contain the so to the point. This is a vast topic. We can take a number of things on this. So, presentation was good. And as a psychiatrist, we are not only here to treat with illnesses. That is one aspect of this topic. That we should also know. We talk about mental health. There are some things we should have some information about. This is one of those areas from this discussion about normality. Thank you. Thank you.